Hello and welcome to our special broadcast, the debut of Times Fact India Outbreak Report. The only report on coronavirus which will tell you where India is headed in next 2 weeks. Which are the states which need to extend the lockdown? What has been the impact of this lockdown on various state and the economy on an aggregate level? How exactly are Indian states, hospitals and our tertiary sector really prepared to fight the coronavirus? So over the next 2 hours, a range of topics we would be discussing on where the numbers are headed, what is the level of state finances, which states currently need to work more closely on the entire medical chain, and which states currently do have to rethink the economic planning looking at the state finances. So Tamanna, this is a special broadcast, and next 2 hours we would be discussing, debating, dissecting and I guess analyzing lots of medical and economic scenarios.
Absolutely, Nikunj. In fact, any person who joins us right now will see a range of views. Let's set the context for you though. The Times Fact India Outbreak Report, along with Protivity, puts together an analysis and a projection of the coronavirus impacting India. It gives us a sense of how long it will take to return to quote unquote a normal kind of situation, by when we will see cases petering out. Of course, here at ET Now, we always look at how this will impact various sectors, impact the economy, and we will also be taking a very close look at the medical infrastructure in our country, a point which has been highlighted by the COVID-19 pandemic, which has impacted the entire world. So let's just take you through 3 key findings before we introduce our guests and start the discussion as per the Times Fact India Outbreak Report. Remember, these are projections based on 6 different models. It's an average of 6 different models which looks at where cases in India could reach. So as per these projections, by the 3rd of May, which is when the second phase of lockdown or lockdown 2.0 is expected to end, we could be looking at 38,534 cases. By the 8th of May, we could be looking at 46,819 cases, while on the 14th of May, we could be looking at 65,601 cases nationwide. These are now a total number of cases. Let's go across now to Dhruvata Ghosh of Protivity, the agency that has helped the Times Network put this report together, and of course looked at the different models which we're looking at. So we will go to Dhruvata in just a second from now, but I also have with me Hemant Thakkar, Dr. Hemant Thakkar, one of the best medical experts. And Dr. Hemant Thakkar will go into the numbers in a little bit of detail, but just your own assessment right now of how the numbers are headed as India enters this extended period of lockdown. We've increased our testing, we've increased our contact tracing abilities. Does it look like we will be able to control the numbers on the lower end?
Well, we've certainly done what we could do best, and that is increase the number of testing, and after tracing those people where we have got infections, we try to contain them. So testing, tracing, containment, and in the containment, we've become quite strict. We've seen to it that nothing leaks out, and we are hoping that if this containment succeeds, the curve will flatten. The flattening of the curve doesn't mean that the number of cases will not increase. The more you test, the more infections you're going to detect. But the ratio between positive cases, mortality and morbidity will start coming down. You might have positive cases, but they may not need hospitalization. You may have symptomatic patients, but they may not need ICUs. And the real definition of the curve flattening would be when the number of cases that can erupt from one infected individual comes down. where you do not see that one individual can infect 8 to 10 to 20, or even some people hypothetically said 400 cases. So you have to dilute the virus. And how do you know that the virus is getting diluted? You know that the virus is getting diluted when you see more number of patients testing positive with no history of symptoms. And the speed of testing positive should go down if you have contained them. So you gradually release those cases into the population. You know, it's like eating a large, big mirchi, a red capsicum, which is spicy. If one person were to eat it, he would choke and probably die. But if you crush that capsicum or red paprika into small pieces and distribute it all over the community, the little pieces of capsicum would be digestible, would be eatable, and would not affect the population. So containment and mild lockdown release over a period of time would help decrease the virulence of the virus, would help increase the herd immunity and our ability to take the virus into our immune system and into our gatefold. If you ask me, when are we going to peak? I think we are in a cinema hall where the interval may have just started and we have a lot of film still to see. We don't know if we suddenly break down this lockdown and we have a surge of people all over the country coming out and cross-mixing, we could then go the Italy way or the New York way. We only rely upon the fact that Indians are tough and we have a different genotype and phenotype and BCG and blah, blah, blah. We have to take the precaution. We are moving in the right direction. The graphs epidemiologically are not wrong. We are a huge 1.3 billion population. We are going to increase our numbers. What remains to be seen is not numbers alone. What needs to be seen is whether these numbers are going to translate into hospitalization, are going to translate into ventilator requirement, are going to put a great strain on the medical system. My COVID warriors are working hard, and COVID warriors doesn't mean doctors and nurses. It's the municipality, the police, the traffic, the people who are good. You know, what is courage? Courage is not being not frightened, but courage is knowing that you are afraid, but still doing what you are supposed to do despite being afraid. And this courage is what I am appreciating. It's been a good month. We are into this, and we are going to be into this for as long as it's required, because it's a small investment in a few weeks for a translation into a good, long, healthy, happy life. And that's what I would say to initiate this conversation.
I think that's a complete endorsement, Dr. Hemant here, the fact that lockdown has worked. But the projections are indicating that the lockdown till 3rd of May may not be enough, especially in Maharashtra, Tamil Nadu, parts of North India, where the spread so far is not getting contained. So one goes by the projections, and these are various models which Protivity has done. Based on the average assumption, I guess we are nowhere close to peaking out, and the peaking out may actually happen same time next month. How scary is that? And do you think one should get worried about the fact that projections are indicating that we've not peaked out despite a 4-week lockdown?
Definitely. It is scary. We need to worry about the fact that our numbers are going to spiral. But if these numbers go up gradually, they grow up slowly, and we contain them, then we don't have to worry. For the simple reason that they will be treatable, controllable. They will not need, like I said, a drain of intravenous medication, excessive nursing, excessive doctors. But one does not know. If the summer turns against us, if civil disobedience steps in, if people take law into their hands and change this disciplined environment, then we could be in trouble. We should not be lulled into complacency, thinking that we are on the right track and that we don't need to worry. I'm hoping that this game changer virus forever changes the way we live. Spitting, gutka, pan, those saffron stains outside every elevator, every corner should be banned, should be fined, should be imprisoned. Hygiene, cleanliness, I think masks are here to stay. We can forget spending money on cosmetic and lipsticks. We need to wear the mask. Social distancing, even banks, even restaurants, they all will have to follow social distancing. The airlines have already started selling alternate seats. So social distancing, hygiene, hand sanitizers, everything is here to stay. Remember, what began with corona will probably change our life. We used to boil our needles 25, 30, 40 years ago and reuse them. Then we came to disposable needles. The family planning invented the condom for controlling families. Then it has taken up a new role, and that is to prevent HIV. So by the same way, corona is going to be a hygiene game changer, is going to teach us not to cough in public, not to sneeze in public, not to discharge in public, and is going to teach us to love our home, to not unnecessarily go out and congregate. If you have to flock together, it is at a distance. Your close, near and dear ones are extremely invaluable. You don't have to congregate in large places to celebrate, to have fun, to even pray or to have any religious ceremony. This is going to change in the times to come.
So, very interesting perspective there about the new normal that we will see. The question is when it will kick in, because that point of when we start petering out on the number of cases will impact a lot of factors. It not only will impact the health of people, the phasing out of the lockdown, but also the economic scenario in very large ways. So I want to welcome now Siddharth Sanyal, Chief Economist and Head Research of Bandhan Bank. Mr. Sanyal, great to have you on this mega broadcast. Just to get your perspective, if we see a number of cases peaking post 3rd of May, and this seems like a possible scenario based on 6 different kind of projections and methods that have been used in this research that we have seen and which we are presenting today. What does this mean for the return to productivity, to return to economic activity?
Well, it's extremely important at this moment or the last few weeks what we have seen, that we have attached, and rightly so, a priority to saving people's life at this juncture, taken a very, very cautious stance at this moment. But at some point of time in a country like ours, you have to strike some kind of a balance between life and livelihood. And to some extent, even though the disease is far from coming under complete control, you have to explore a few possibilities or a few areas geographically or in some other way that where you can actually bring back some kind of economic activities to help people. So basically, what we are relying upon at this moment, my sense is that the red, green, amber classification that the government has come out with, that will remain in force for a pretty long period of time, because as we can find out that even though the lockdown currently will likely get lifted from 3rd May onwards, there are certain pockets in this country, and economically extremely important pockets such as Mumbai and all, where the spread of the disease is much more rampant than what we had anticipated a few weeks back. So in this kind of a situation, most probably what we'll be seeing, that you might actually see continued lockdown in some of the pockets, but at the same time, in some of the districts, some of the pockets, some areas, you might actually see some phase relaxation. And there, you might actually see some bit of relaxation in possibly in the rural segment, rural areas of the country, where the spread of the disease is relatively better under control, the social distancing, etc., with a bit of awareness, spreading in the hinterlands might be slightly easier over a period of time. So my sense is that you will be seeing that over the course of the next few weeks, and that's the way to go back to normalcy in a very phased and staggered way, because you cannot go back to normalcy all of a sudden, but at the same time you cannot keep a lockdown kind of a situation for a completely indefinite period of time as well.
Okay. Now I'm going to again go back to the impact state-wise, and here's what we've managed to look at, and the state-wise GDP contribution, which perhaps is going to be very large. States where the COVID is not showing any signs of peaking out. That starts with Maharashtra, which accounts for nearly 15% of the total GDP contribution. Tamil Nadu stands at a neat 10%. For Telangana, the number is 4.5%, and for Uttar Pradesh, it is in single digit, but it's a large state to reckon with when it comes to the immigrant population and when it comes to the demand side of the equation. Dr. Hemant, my next follow-up question is, states where we know that where definitely there is a problem, and in cities like Mumbai and cities like Delhi, we are nowhere close to peaking out. Is it safe and logical to assume that even if lockdown is removed on an all India basis, partial lockdown in some of these affected states will continue? Now, economically, I may argue that, okay, Maharashtra is a big state, Tamil Nadu is a big state, Delhi is a core state, but you have to pay the price. Right now, economy does not matter, and that's the right way. Even though these are progressive states and large contributor states, the chances of a partial lift down in some of these states is going to still happen.
So we are on ET now, and I'm now going to give our viewers an ET shock, extraterrestrial shock. Remember, this virus is going to finally get to all of us. Me, you, everybody is going to test positive sooner than later the moment we get out into the population. That's the only way we will develop immunity. Now, your question about states like Maharashtra, Delhi, and the others, I fully agree with you. And this is where I think we need to use a carrot and stick approach. If the states, if the people living in the states are shown that the light at the end of your tunnel is very far away, and you need to behave, and you need to toe the line, at least they will discipline themselves a little more. And just now, I can see that if in Maharashtra, we prematurely lift the lockdown until in the next 14, 15 days, we see some improvement, there will be a splash of cases. We have migrant labor, we have slums, we have people coming in from all parts of the world who have already come in. And we have an anonymous virus whose credentials we really don't know much about. We're learning every day. What began as a respiratory virus now affects the gastric system, affects the heart. It can have all sorts of presentations. So one will have to really sit at night with the midnight oil and juggle all the figures before lifting the lockdown. And even if the lockdown is lifted in certain quarters, in certain slums, I'm afraid for their good, more than the good of others, which is also important, the good of the community, for their good, it is extremely important, because especially in those pockets, the hospitals are sparse, medical services may not be enough. So we will have to be very careful. And as you rightly said, we are finally going to decide as health over wealth. And health being the real wealth, economy and all the contributors of GDP will have to take a back seat, while the health of the population is more important. I agree with you.
Okay, I want to welcome on to this special broadcast Sanjeev Sanyal, Principal Economic Advisor, Ministry of Finance, of course, Government of India. Mr. Sanyal, welcome and thank you for speaking with us here on ET Now on our mega broadcast, where we're talking about when we will peak possibly, and of course the impact that will have on economic activity. I want to start by getting your point of view on the economic side of things, keeping in mind that health is of course the topmost priority, as it should be. But can we look now at a larger lift in phases of the lockdown so that we preserve economic activity?
I think I would agree with the previous speaker that this has to be seen first and foremost as a medical emergency. I think the Prime Minister has made that point as well. And that if we don't take care of that first, we really can't get the economy going as well. Even from a purely economic perspective, the health issue has to be taken into account, because obviously we can't open up the economy if this keeps spiraling out. So I think don't separate the two. The health issue is absolutely important. However, having said that, obviously livelihoods matter, the economy matters, and of course, in the longer term, we still need to take care of other diseases. We need to take care of food issues, livelihood issues, and so on. So as time passes, the economy and its requirements will begin to become very important. So the approach we have taken, which is somewhat different from many other countries, is not to come up with one big bang package for the economy. Instead, we have taken a more calibrated approach, a step-by-step approach. We, at every stage, take into account the requirements at that time and are delivering medium-sized packages, one of which you got today from the RBI. Let me assure all viewers that we remain committed to doing what it needs, but we will do it through a feedback loop approach, by which we deliver these in a more calibrated way than maybe other countries have, and maybe some people would prefer